Good health is the cornerstone of progress, and the Association of Black Cardiologists is committed to making quality health care accessible and affordable to all. For 47 years, we have embodied our mission of lowering the high rate of cardiovascular disease, including stroke, in minority populations, and remain committed to advocacy, research, education, and diversity. Health Equity in Motion not only describes the work of the Association of Black Cardiologists, but also defines the core of ABC's organizational DNA. Even in the midst of a global pandemic, we're still tackling health disparities, addressing social determinants of health, including racism in medicine, and sounding the alarm on the lack of diversity in both the healthcare workforce and clinical trials. The increased awareness and spotlight on these issues have brought ABC's work front and center. The advocacy agenda adopted earlier this year by the ABC Board of Directors guides our policy, legislative, and regulatory activities through 2022. ABC has amplified its voice in response to critical issues such as physician fee cuts and medical equipment shortages, and in advocating for policies that support practices and community institutions during the pandemic. The question arises all the time: how do we close the gap in healthcare equity? ABC has continued to lead that conversation by sharing our views and ideas with congressional committees, federal agencies, and the media. In a communication to Capitol Hill, we stated that failure to address inaccurate outputs from clinical algorithms that are incorrectly programmed to factor race and ethnicity will perpetuate disparities in care. A rapid response COVID-19 task force has kept clinicians and community members updated on the evolution of the virus, its treatment, and prevention through a webinar series, community facts, and research journal publications. In fact, webinars and roundtables on COVID-19, Black maternal health, and workforce diversity have produced a record number of state-of-the-art publications for the organization. Efforts to foster a more diverse healthcare workforce have spurred several activities, including a roundtable, a webinar with program directors from the top cardiovascular training programs, and the relaunch of a scorecard program called ABC DIBS, Diversity, Inclusion, and Belonging Scorecard.
See, you can't be what you can't see. And I have to tell you my story. When I was a medical student and had a different career path envisioned, and someone dragged me to the Association of Black Cardiology meeting, and that changed my life. And I will never be able to give enough gratitude for that, because I never would have believed I could do it if I didn't see it. And the number of mentors that I made along the way who have continued to mentor me and write my letters for advancement, etc., is just, beyond, I can't even begin to give enough thanks.
Central to ABC's mission is ensuring more minorities, both patients and investigators, are included in clinical trials. As such, our ABC Research Committee rolled out a clinical research network survey to our physician members. Feedback from our members will be important in helping us with this effort. We considered it a top priority to provide education for both physicians and the community, with a focus on key health issues affecting Black communities, such as high blood pressure and cholesterol, obesity, heart failure, and stroke. Virtual symposiums and webinars kept our mission and message thriving, including our Train the Trainer Community Health Advocacy Training Program, with cohorts in New Orleans and Jackson, Mississippi, as well as several community-oriented table talks for women across the lifespan. Upcoming initiatives include EDIT, Educate, Identify, Treat, Control BP. Our blood pressure control campaign is rapidly progressing with a demonstration project underway in Atlanta. ABC will convene multidisciplinary roundtables centered on obesity and valvular heart disease in communities of color. Summary reports highlighting solutions from both proceedings will be issued to partners and supporters. We are especially proud to report that the ABC family expanded and reached a milestone in membership growth. Additionally, for the first time, members had opportunities to apply for several new research awards, including the COVID-19 Innovation Awards, the American College of Cardiology, ABC, Merck Research Fellowship, and the Heart Failure Data Challenge, a collaboration between the American Heart Association and ABC. The ACC and Merck joined forces with the ABC to offer a research fellowship in the amount of $100,000, exclusively to a physician fellow who is an active member of the ABC, with preference given to an applicant focusing on disparities of cardiovascular care in the areas of gender, race, geographic, and economic inequalities. The Heart Failure Data Challenge is a 6-month data challenge focused on deepening our understanding of the impact of the social and structural determinants of health on heart failure. Researchers are competing for a $25,000 grand prize, with the second place team receiving $10,000 and the third place team receiving $5,000. Winners will be announced in 2022. While the work of the ABC is far from over, we pause to celebrate the milestones reached on our quest to promote the prevention and treatment of cardiovascular disease, including stroke, in Blacks and other minorities, and to achieve health equity for all through the elimination of disparities.
Access to care and quality of care are part of the health equity equation, but they're not the end game, because the end game is actually health.